You know, if you're a police officer, you go where the crime is. Well, I'm an ER doctor. I come where the work is, the violence is, the things that make me glad to do what I do.
For 250,000 people, this emergency room is the last best hope when something goes wrong.
Well, my mother got sick. We had to rush her over here to doctor's hospital. It's not an ideal place to come hang out, but at least if you need to be here, it would be here.
Oh, without a doubt. Without a doubt, this is the workhorse. We are the engine that drives health care in this community.
40,000 patients a year, about 110 every day, including 62% of the region's ambulance calls. And on any given night,
20 to 30 children that were sick, 2 or 3 patients that had a heart attack, 2 or 3 patients that had a stroke.
Gunshot wounds, probably one every week. We had a refinery fire where we saw 12,000 people in 4 or 5 days.
Still a little shaky here.
The drunk.
No more drinking tonight.
The indigent, the homeless.
Just as soon as one bed is cleared, another patient rolls in.
Every 20 minutes, an ambulance arrives at our door, and we take anyone regardless of their ability to pay.
And that is exactly why this hospital is facing a $20 million budget shortfall.
People who need this health care who necessarily can't afford it, either we are at this country are going to say we're going to pay for it or we're not. You would not debate this at John Muir and Walnut Creek.
The next patient through the doors, an elderly woman with late-stage cancer.
Yeah, and you need ER in your community, not in the next county.
After hours of treatment and a discussion with Dr. Stephen Cady, Giselle Bonds and her family knew that her mother's battle with cancer would end here tonight.
How can you not have an emergency room in such a wide, it would create such a vacuum. And so I'm grateful that they were still here tonight.
Tonight, but probably not much longer. A grim reality that's setting in, not just for families desperate for help, but also the men and women who deliver it.
They've spent their whole lives helping people doing things thanklessly in what are very, very difficult conditions. I feel lucky. I feel honored to be part of that, and I try not to forget that.